Hi, I'm Dr. Kristen Sato, one of the primary care providers and women's health providers here at Student Health, and today we're going to be talking about the implantable subdermal contraceptive devices, also commonly known as Nexplanon or Implanon. Implantable subdermal contraceptive devices are over 99% effective as a form of birth control. They're more effective than pills, condoms, and withdrawal, mostly because they work independently of you, and you don't have to remember to take a pill every single day or come back in for a shot or use a condom or anything like that. If you've spoken with your primary care provider and decided that an implant may be right for you, you may have some questions regarding that. It's very important that you and your partner are using consistent contraception for the 2 weeks prior to getting your implant placed. That can include abstinence, using condoms every single time, the entire time you're having intercourse, or using birth control pills or another type of hormonal contraceptive. It's very important that you're using contraception for the 2 weeks prior to the placement of your implant, because we don't want you to be in the process of getting pregnant at the time that you get your implant inserted. When you come in for your appointment, we will perform a pregnancy test, so make sure that you're able to use the restroom just prior to having the implant placed. And you may bring someone along with you to the procedure if you choose. They will sit in the room with you, or they could wait out in the lobby. So prior to the insertion, your provider will go over the consent form and any additional questions that you may have. Next, you'll get up onto the exam table and you'll lay down on your back, and you'll have your arm up at a 90-degree angle, and we'll mark the area where your implant will be placed. And it's in the upper part of the arm, right here between the biceps and the triceps, and it's just a little bit either below or above that area. We typically place the implant in your non-dominant arm, but it can honestly go into either arm. It's completely up to you, and you can talk to your provider about that before the placement. So after we mark the area of your arm where we'll place the implant, we clean that area off with an alcohol wipe, and then place a little bit of lidocaine, which is a numbing medicine, into the area where the implant will be inserted. The lidocaine is honestly the worst part of the whole procedure, because it's a poke and a burn, and then after that you won't be able to feel anything but just in the area where the lidocaine was placed. And so it's actually just a very small area that will be numb. You'll be able to feel pressure there, but not anything sharp. And it doesn't go down into your arm or hand or anything like that, so you should be able to do schoolwork or drive home or anything after that. We clean off the area again very well prior to doing the insertion, and make sure that you're not feeling anything sharp in that area, and then place the implant, which takes approximately 3 seconds to do. It's very, very quick. We place a small bandage over the insertion site, and then a larger pressure bandage around your arm. The smaller bandage will stay on for about 5 to 7 days, or until it gets crusty and falls off. And then the pressure bandage you can keep on for 24 hours, and that really helps with the bruising that some people experience after the insertion. That bruising is fairly minimal, but it may happen, and so that's why we have you do that pressure bandage for 24 hours. After the insertion, your provider will go over infection precautions to make sure that your insertion site just stays clean and healthy. There's no follow-up appointment needed after the insertion, and the last thing is that we recommend that you use a backup form of contraception for the 7 days following your procedure of your implant placement. So this can include condoms every single time, or continuing your type of hormonal contraception that you're using prior to the insertion. If you feel like something is not right with your implant, or there's any signs or symptoms of infection, or you just have any additional questions, you can feel free to call our advice nurse, and you'll be provided with that phone number at the time of the insertion.